Since my preceptorship, I've grown to love nursing more than I could have ever imagined. I did my preceptorship at the nursery in Singing River Hospital at Ocean Springs, and I worked night shift. And so I didn't get to see everything I would have wanted since I was on night shift, but there was one particular shift where a mother came in earlier that night and she was there for a scheduled induction. She had gestational hypertension, and so the labor and delivery nurses were very closely monitoring her pressures, monitoring the baby all throughout the night. And so after close monitoring, keeping her, within those therapeutic ranges and giving her meds, calling the doctor, they realized at one point that it was starting to get, starting to turn bad. And so they called the doctor after they realized the baby's heart rate was dropping a good bit. They called the doctor. The doctor immediately called a stat C-section. And I guess that was the point where I realized, okay, things are getting serious. And that was where I realized, I just, all the teamwork that happened, all the doctors got called in, the pediatrician, respiratory therapist, the OB all arrived within 5-10 minutes to the hospital. The nursery nurses, it was their job to call the pediatrician, update them of the client, let them know the situation and that we were about to go to a stat C-section, and then the respiratory therapist the same. I just thought it was very interesting how all these different interprofessional teams, I know we use that word a lot, were just actually coming together and using their skills and their knowledge to help this one patient. I just thought it was very emotional almost to see how these people came together just to help save the life of both of these people. They used all their skills. Everything was communicated very, very clearly. Everything was in a timely manner. And it just truly affected me because I realized how many moving parts go into just the day-to-day life. I know these stat C-sections happen way more often than we see, and we've learned about them, but just experiencing that in real life and to see how much these people care and are dedicated to their profession and their patients, and they really truly do care about their patients' well-being, and they want to make sure they're okay. And so it was just very emotional to see people running down the hallway, sprinting to the OR, getting the OR ready as quick as they can, and being in the mix of all this, just kind of having a step back was just very eye-opening to see how everyone was so positive, everything ran so smoothly, and I just really enjoyed getting to see all the teams working together, and it ended up being a good delivery, and everything turned out perfect, and so it was just very rewarding after that.